Hello, and welcome back to our webinar series where we discuss a number of topics related to medical cannabis. Today, in our 8th episode, we're going to discuss arthritis symptoms and relevant information about medical cannabis use. We'll be talking about specific strains and cannabinoids currently being researched for potential efficacy in managing symptoms. And as usual, we'll end with a Q&A session. So just to let you know a bit about myself, my name is Barb. Over the last several years, I've developed patient care service departments and policy, and I'm currently involved at the clinic level, helping patients gain access, information, and support on all topics related to medical cannabis. I'm joined today, as always, by my colleague and my wonderful co-host, Johnathan Wierenski.
Thanks so much, Barb. Hello, and thank you everyone for joining us tonight. Please excuse me, I'm coming down with a bit of a cold, so bear with me. I lead up the counseling team at Canadian Cannabis Clinics, and I serve as a subject matter expert. I specialized in pain management for 17 years, and I've studied cannabis for about 25 years. As always, please note, Barb and I are not physicians, and we're not providing specific medical advice during this webinar series.
So, Johnathan, I think you're going to agree. There have been a massive number of patients that we've seen in the clinic setting over the years who are seeking or have sought to manage arthritis-related conditions with medical cannabis. It probably is the single largest group of patient populations that we see.
Yeah.
Exactly. And, tonight I'm also going to be asking Johnathan, we're very fortunate to have him with us, just a few questions at the beginning of the Q&A portion, because Johnathan, you are a former RMT and also someone who lives with a very specific form of arthritis.
Indeed. I was a registered massage therapist for many years, and as such treated many variations of arthritis because it affects so many people. And I do live with arthritis myself for over 40 years now, and use medical cannabis in a few different ways daily to manage my symptoms.
So we've already had a number of relevant questions come in by email already. Thank you so much. And hopefully the content's going to cover those off this episode and this evening as well, too.
Also, in addition to our technical production team here with VJ in studio, we're also joined by Megan and Graham, experts from our patient care team, who will be answering your questions online during this episode.
So let's get started by taking a look at what is arthritis and its related symptoms.
And to begin with, let's just explain that arthritis is a compound word, arth coming from the ancient Greek to mean limb or joint, and itis, the suffix, which denotes inflammation in medical terms. So arthritis means joint inflammation.
So arthritis actually includes a very large group of about over 100 variations of disease presentation, and it affects about 1 in 5 Canadians. Now, we won't be able to discuss them all, but arthritis is a chronic disease which can affect individuals of all ages and can come on suddenly or progress over time. It's generally characterized by inflammation, and that's the medical term for swelling as well as redness and resulting pain and stiffness, especially in joints. Now, inflammation can lead to tissue degradation and permanent debilitating damage of affected areas.
Weight-bearing joints, hips, knees, and spine, very commonly effective. And of course, the hands, fingers, wrists, ankles, feet, toes, also frequently involved. And symptoms are not limited to just joints. Connective tissues such as muscle, tendon, and ligaments can be involved, as well as skin and the lining and the covering of internal organs and the eyes.
Now, arthritic conditions are grouped into 2 broad categories, those being osteoarthritis and inflammatory arthritis. So osteoarthritis, OA, osteo meaning bones, and again, arth meaning joints, and the itis denoting inflammation, means bone joint inflammation. And it's definitely the most common form of arthritis, and again, among the most prevalent that we see in the clinic setting.
Yeah, actually, osteoarthritis affects more individuals than all other forms of arthritis diseases combined.
Now, it used to be referred to as the disease of damage due to wear and tear of a joint, but that definition's actually evolved to be better defined as the inability of the body to repair joint tissues which have been compromised. Now, this damage often comes in the form of the breakdown of the cartilage that covers and protects the ends of bones where a joint is formed, and that results in painful movement and continued degradation.
And some factors that can contribute to the development and progression of osteoarthritis include age, joint surgery, occupation, sports injury, obesity, and of course, a genetic predisposition. So that's a bit about osteoarthritis. Now, with inflammatory arthritides, the joint degradation is a result of damage caused by an overreaction of the inflammatory process rather than the inability to keep up with repair of that wear and tear. So white blood cells of the immune system attack joint tissues as though they were foreign invaders like a virus or bacteria, and tries to destroy the cells that make up those tissues.
Now, inflammatory arthritis includes all other types of arthritis as well, apart from osteoarthritis. Here too, joint damage results in pain, stiffening, restricted mobility, but also to joint deformity can result in then resulting as a cause of that loss of function. IA can affect anyone from children to those of advanced age, regardless again of gender or ethnicity.
Yeah, and among the variations of inflammatory arthritis are autoimmune disorders, rheumatoid arthritis, psoriatic arthritis, juvenile idiopathic arthritis, lupus, and ankylosing spondylitis, which is the version that I live with.
Now, in fact, some forms of IA are systemic and involve not only the joints, but also to the soft tissues in many organs. And this is why early detection and treatment are key to prevent internal organ involvement, joint damage, permanent joint deformity, and also to halt or manage the disease progression.
Now, rheumatism refers to a variety of conditions which are characterized by pain in the joints, fibrous tissues, and muscle. Rheumatoid arthritis is the most common autoimmune inflammatory arthritid. A significant number of the patients we see in our clinics live with rheumatoid arthritis. So in this case, in rheumatoid arthritis, the immune system targets the tissues that line affected joints. To envision this, you can think of a joint as a system where the articulation of two bones facilitates the movement of body parts. Covering the joint is a tough ligamentous tissue called the joint capsule. It's like a bag holding those two bones together, and there's a special lubricating fluid held inside the capsule to allow for smooth range of motion of the joint.
Now, according to the Arthritis Society of Canada, right now about 300,000 Canadians currently live with rheumatoid arthritis. And interestingly enough, 2/3 of those individuals identify as women.
This condition often begins in one joint and can rapidly spread to others within weeks or months, which is very fast indeed, and potentially leading to debilitation, as Barb said. Now, it's ideal if RA is diagnosed early in the disease progression to lend to more positive long-term outcomes.
And unfortunately, the cause is unknown and there is to date no cure. However, some medications can actually change the progression for some patients.
So some treatment options. Let's discuss the medications and importantly how medical cannabis may be a helpful part of a treatment plan to manage arthritis symptoms.
I think it's fair to say that most patients who start to feel that onset of burning or swelling, pain and stiffness in joints, they tend to start with an over-the-counter product, something like a topical analgesic, perhaps Tylenol, acetaminophen, or aspirin.
And ibuprofen, yeah. And these can help with early symptoms, of course. However, all those medications, they have their own side effects, meaning they're, not just anyone can use them. So when arthritis symptoms become more advanced, patients may be prescribed a number of pharmaceutical options like prescription NSAIDs. And there are disease-modifying anti-rheumatic drugs like the old standby methotrexate. And biologics, while not new, do represent a modern approach by affecting immune proteins to negate the inflammatory process. They're actually made inside of living cells. It's incredible, and they're still very expensive.
And of course, there are steroids as well, commonly prednisone and cortisone. Yeah. And of course, in the case of very strong or stubborn pain, opiates such as fentanyl, oxycodone, and tramadol may be prescribed.
And again, all of these drugs come with some very significant side effect profiles.
Yes, and especially in the case of opiates, I think that there is a serious risk of dependency and overdose, unfortunately fatal overdose as well. Now, it is in part due to the limitations of these medications that many patients, physicians, and researchers are looking to investigate cannabis as a viable means of symptom management.
Yeah, so why consider cannabis? From the recent 2016 Quebec Arthritis Forum, it was presented that 2/3 of medical cannabis patients were using medical cannabis to address their arthritis symptoms. Now, you'll note later a slide that we have referenced and cited a number of studies. And some compelling results of those studies show that phytocannabinoids have produced compelling results in a number of animal models of joint pain. These effects are the results of both the inhibition of pain pathway signaling, which would be mostly CB1 receptors, and anti-inflammatory effects, which would be mostly CB2, Barb.
Now, additionally, there's a 2017 study that suggests the local administration of CBD blocked osteoarthritis pain. Prophylactic CBD treatment prevented the later development of pain and nerve damage in these osteoarthritic joints, and that suggests that CBD may be a safe and useful therapeutic for treating OA joint neuropathic pain.
Yeah.
There is also a 2014 study that reports that the administration of cannabidiol or CBD, often referred to as, significantly suppressed chronic inflammatory and neuropathic pain without causing any apparent analgesic tolerance. That is to mean any resistance, any buildup or tolerance, and that was in a rodent model. Now, apart from emerging research data supporting the use of medical cannabis to treat inflammation and arthritis-related symptoms, Johnathan, I'm sure you'll agree, there have been countless accounts given by patients themselves.
And certainly among the most gratifying aspects of our work is seeing firsthand the benefits that patients experience for incorporating medical cannabis into their treatment plan. And I'm sure that some of our listeners can relate, or have a friend or family member perhaps successfully addressing the symptoms of arthritis with medical cannabis. It's just so encouraging to see.
It is. And you know, we do say as well to that cannabis
Very
is
importantly
not a panacea.
Yeah.
It is not a cure-all. In fact, there isn't any evidence to say that it can cure anything. And THC can have some associated risks, especially for those living with certain mental health diagnoses, pre-existing conditions, or using certain medications. And again, that's why we always encourage patients to begin treatment with medical cannabis under the guidance of a knowledgeable health practitioner.
So let's talk about relevant medicinal compounds in cannabis, which we've discussed, the cannabinoids and terpenes.
And at this point, we're going to refer you back to earlier episodes in this series. Episode 3 especially is CBD for me, and episode 7, the last one, the chemistry of cannabis, for some additional background information here. And you can find those on our YouTube channel. Just go to youtube.com and search Canadian Cannabis Clinics, and those webinars will come up.
Yeah, and in those episodes, we discussed other currently lesser studied cannabinoids like THCA, which appears to demonstrate an anti-inflammatory capacity, and it's derived from fresh cannabis as opposed to dried and cured, and it's often consumed in a juice form.
Yeah, that's a really interesting cannabinoid, absolutely, and definitely sort of on the one-to-watch list with efficacy in inflammation. So we also discussed terpenes as well, too. The terpenes are chemical building blocks of taste and smell. Myrcene, pinene, and especially of note, caryophyllene, all of which can be found in the cannabis plant, may also play a part in combating inflammation. So let's get to the practical aspects of using cannabis to manage arthritis symptoms.
Right, so what to take? So CBD, one of the 140 odd cannabinoids found in the cannabis plant, treatment using CBD is often a great starting point. And it can be optimal, you know, given the lack of psychoactive effects it produces. It has a great safety profile, including a real low risk of interactions.
And you know, many patients do remark that the concern of being high prevented them really from considering medical cannabis. And Johnathan, I know that we've definitely met patients who would rather be in pain than sort of go through the feeling of being high. And so the use of CBD products can really address those very, very valid concerns.
Yep. And apart from being a key player in the reduction of inflammation and pain, CBD may also be helpful as a sleep aid and in regulating mood. Now, with the reduction of pain, patients often do report better sleep, and that often lends to improved mood, right? When you sleep better, everything works better.
Everything is connected. So, you know, I think many people ask, and I know because we get emails from patients all the time, what's the best CBD strain? What should I be taking?
So very commonly, low THC, high CBD products are, again, a good starting point. In Canadian licensed producers, you'll see a strain called Cannatonic. Although it can go by other names too. It's a very, very popular high CBD strain.
It is. It's one that we probably, again, see the most, and that's a low THC, usually less than 1%, with CBD values anywhere usually from 12, 14, 16.
You can go even exceed 20%.
And exceed 20. So Cannatonic, one to look out there. Now let's move on to THC. So THC, as we often mention, it does produce that feeling of being high, that euphoria that most associate with cannabis use.
Researchers and physicians are recognizing the therapeutic attributes in THC in the medical context, and patients often report that THC can help to soften or even deaden, or words we often hear, those feelings with chronic pain.
And, you know, THC can be very effective even in very, very small doses. In fact, many patients mentioned that they find relief in what could be described as microdosing. And I'm sure that's a term that's getting thrown around a lot lately. It's very popular. And it is what it means, just very small doses. In the case of a vaporizer, maybe 1 to 3 inhalations, or simply a matter of just a few drops of cannabis oil.
I think as well, it's important to note that within the medical cannabis product line, there is a tremendous amount of variation. Some medical THC strains can be extremely potent. They can even exceed 30% THC now. And it's interesting to note that the Canadian Medical Association and the College of Physicians and Surgeons support the use of THC strains between a 9 to 12% range. And studies have shown that this lower percentage of THC can be extremely effective in managing certain types of pain, including neuropathic pain, which can be very difficult to treat.
Yeah. So again, there are plenty of options to tailor to individual needs. And again, too, within the medical system, usually again, for medical patients at a lower price.
Yeah. So THC indica strains, especially those high in the terpene myrcene, are reported as being an effective alternative to prescription sleep aids due to their sedative and relaxing properties, which may, for some people, also be helpful in dealing with anxiety. So popular indica strains that patients report as effective include strains like LA Confidential, Pink Kush, in fact, many from the Kush line. And just keep in mind that you'll often see these names with other names in an LP. So
That's
you've got
right.
to look at the website and look at both names.
Absolutely. So patients also too do report that sativas, cannabis from the sativa family end of the spectrum, can have medicinal benefits for their arthritis as well. When managing chronic pain, lowered energy and mood, it can often become a significant reality of life. And especially again, when sleep is compromised. Patients do often remark that using a sativa strain during the day may help to provide them that sort of get up and go just to handle everyday tasks, again, work through that pain. For some patients, the right sativa THC strain can be very effective.
Yeah, they certainly help me, I can say. Once a patient establishes an optimal dose, which is very often within the first few weeks, and journaling and trying a few products, THC can become an extremely useful part of, again, that symptom management toolkit.
And again, I'm sure a lot of listeners would like to know, well, what strains and products should I be using? And again, this is such an individual experience and is based on a number of factors. But perhaps, Johnathan, you could mention a few sativa strains that, again, from your experience may be useful.
Yes, I certainly can. Sour Tangy comes right to mind, just a great example for daytime pain and discomfort for me, as is a strain called Della Haze. They're both sativas.
Yeah.
Another very interesting focus of research is how THC and CBD interact with one another, and we're speaking again to the entourage effect, of course.
So a scenario often encountered in the clinic setting is the patient who has begun low THC, high CBD treatment, but for whatever reason doesn't notice any effect or, again, a very minimal response. Of course, there's never any guarantee with medication, any medication, but it's certainly, of course, it can be very discouraging when you don't get the relief that you hoped for.
And we've heard from many patients who find relief when moving to a balanced one of those one-to-one products with a closer ratio of some THC and CBD. And indeed, studies have shown that the presence of even a small amount of THC can have a positive impact as opposed to using CBD alone in treating pain. In fact, a 2010 study suggested that THC and CBD working together in the entourage effect could be a potential alternative to even opiate medication.
Again, so very, very powerful analgesic and anti-inflammatory potential there.
Yeah.
And of course, again, for those concerned about the psychoactive effect of bringing THC, even a small amount into the picture, absolutely, again, a very valid concern. However, what's interesting is that studies have also shown that CBD can actually minimize the psychoactive effects of THC, essentially watering down or canceling out some of those euphoric causing properties. And again, this makes one-to-one balanced strains a very viable sort of next step for those who aren't finding relief with CBD alone, or perhaps also for those individuals who want some effects of THC, but again, not at that strength and intensity that a higher THC only product is going to offer.
Yeah. So one-to-one products are extremely popular in the medical cannabis community for addressing arthritis. And there are many, many options, indicas, sativas, and hybrids.
I think the takeaway from this is that there are so many options out there. And yes, it can be very daunting to start with. Everyone's needs are different, and there are so many factors, both medical, but also too, general lifestyle.
We counsel patients to be patient when beginning with medical cannabis and to be open to trying products. And again, the importance of journaling the results just can't be overstated.
Some patients may do really well just using one product alone. Other individuals may find that it's a variety of products that are required for different times of day and for different symptoms. And that sort of takes us to how to take your cannabis and when.
Yeah. In Canada, legal medical cannabis products currently come in several forms, including dried flower, edible oils, encapsulated oils, oils blended with skin creams for topical applications, and now even a new pre-packaged vape pen for inhaled use, which truly is an exciting new product.
One benefit is that, as with strain and product selection, patients have a number of ways or forms in which to take their medication.
And as with strain and dosage, it may be one form of cannabis or a combination of different types for different times of day, different symptoms, and different, symptom intensity too. So with oils, we would recommend that you actually revisit episode 4 and 5, where we discuss cannabis oils, as well as creating your own edibles. And edible oils are extremely effective and appealing for a number of reasons, as mentioned. And they're generally the go-to product for many patients now.
Yeah, definitely. We see a lot of patients really gravitating towards the oils. Now, oils take anywhere from, let's say, about 30 minutes to about 120 minutes to take full effect. And they do offer long-term relief, anywhere from 6 to, in some cases, depending on the person, up to 10 hours, making it ideal for either all day or all night management of symptoms, again, and very effective as a sleep aid.
They're discreet, easy to use. Take in my mouth, you can hold it under your tongue, swallow it, take it with food, add it to a food product, or even in your morning coffee or tea, which is my preference to start my day.
I think another appealing factor of oils as well is for those who, and again, something that we've seen frequently, for people that we're speaking with tonight, for those who have limited or compromised use of your hands due to inflammation. It can be extremely challenging, we know, to grind and prepare dried cannabis for use. And with oils, that's basically just taken out of the equation for you.
And they're extremely effective. Orally ingested THC can have a very potent, long duration effect. Now, for that reason, we often suggest that patients exercise caution when starting out with an oil product containing THC. Our standard mantra: start low and go slow.
Yep, start low and go slow. You will always hear that every episode, no matter what.
Yeah.
Now, again, dosing and titrating schedules can be very individualized. We do go through a basic schedule with you in episode 4, but just to give you an idea, most patients do consume anywhere between 1 to 3 milliliters of cannabis oil, and that's total per day. And will often use their medication about 3 times daily, usually one dosage in the morning with an afternoon dosage, and then perhaps a dosage before bedtime. So moving on to dried cannabis. And I think dried cannabis has historically always been sort of the go-to for the medical user. Of course, typically rolled into a cigarette and then smoked. Now, of course, smoking cannabis is not optimal for a number of reasons. The most important, obviously, being lung health and avoiding the carcinogens that are produced with combustion and smoking.
Yeah, and instead, dried cannabis can be highly effective when inhaled using a vaporizer. Simple little device that heats cannabis to an optimal point to release the medicinal compounds in a vapor, which is then inhaled.
And one of the benefits of inhaled cannabis is that, unlike oils, inhaled cannabis has a very fast onset. Users will notice effects generally within moments, literally seconds or minutes of inhalation. And unlike oils, the effects of inhaled cannabis last a little bit shorter, about 1 to 3 hours, and the effects usually begin to taper off around hour 3.
And that can be absolutely ideal for individuals who don't want long-lasting effects, as in for a PRN, right? Like as needed. It can quickly address symptoms like breakthrough pain, and it can also be used after taking an oil to provide fast relief while you're waiting for the oil to take effect. Just be careful not to take too much at once.
I'm glad you said that because I was going to throw that in. Exactly. Now, using a vaporizer is quite simple. And as with oils, it is very discreet. Of course, I think we're probably all familiar with the very strong and skunky scent of burning cannabis, and it's certainly not for everyone. Now, because cannabis does not combust, does not burn in a vaporizer, it produces very little lingering scent, and that makes it preferable just for use in the home, just generally more discreet.
Yeah. And so topical application of cannabis. these are of great interest, and I know that many of you listening today wrote in with questions about the topical use of cannabis for arthritis pain.
I think we're going to probably end up having to do a whole episode just on topicals. There have been so many requests, yeah. So, there is a 2016 study that did conclude that topical CBD application has therapeutic potential for relief of arthritis pain-related behaviors and inflammation without evident side effects. So very interesting.
Yeah, and currently there are only a handful of topical products available within the legal licensed producer system. However, many patients report that they use their edible oil products as a topical, simply rubbing it into the skin over the affected area.
Also, you may convert dried cannabis to use in almost any form you wish.
Yeah.
And this does include a topical cream. Now, we won't go into it today, but there certainly are many recipes online, and it is a fairly simple process. Often involves a simple stovetop extraction into coconut oil with some beeswax added to it.
And topicals are incredibly safe. They're a very conservative approach, and that can be ideal for the new cannabis patient. And they're non-psychoactive and rarely produce any negative side effects. And they're generally very safe to use with other medications.
And again, topicals may be effective just for use on their own for some patients. And again, for others, may be a very valuable part of that sort of symptom management toolkit.
I love that term.
I do. Thank you. I think I can take credit for it. I did.
Oh, it's yours.
I'm going to take it. Thank you. Now, and that symptom management toolkit, we'll probably come back to this in other episodes, in that your topicals can be paired either with inhaled or oil products for relief, and again, useful for flare-ups or again for stubborn symptoms.
So to kind of bring this all home, Barb, we know that many patients, not just those living with arthritis, would like that simple, quote, magic bullet, unquote, and basic instructions on exactly how to use it to achieve a magic bullet effect. But as we know, with most complex conditions, it's going to take a little time before finding exactly what's going to work for a given individual, especially the more complex things are. That's a lot to consider when looking at a new treatment.
Yes, but that being said, usually all it will take is a little bit of time and an open mind and the willingness, again, to journal and document those doses and products.
And again, from our experience, that effort often leads to patients reducing dependency on pharmaceutical medication and consequently often maintaining or achieving a better quality of life. And as we always mention, taking these steps is much, much easier with the guidance of a physician and with the ongoing support of a counselor, such as you'll find at Canadian cannabis clinics. And if you're interested in learning more about accessing both medical cannabis and counselor support, you're invited to visit our website at www.cannabisclinics.ca. And there you can book an appointment either in clinic or from the comfort of your own home using our new home care service, which involves a secure internet connection.
So we're going to present now a slide with our study citations, and then let's move on to our Q&A section. Of course, you can type a question in the chat box for Megan and Graham, and if your question isn't answered, fear not, please feel free to contact us at webinar@cannabisrx.com, and you'll get a response via email. So on to questions. And Johnathan, because you do have so much experience with us, I wanted to ask you a question about daily life with arthritis symptoms and managing the day-to-day. Do you have any tips for us and our listeners out there?
Yes, tips. I do have tips, yes. My very first one would be the old standby, really. It's explore products and journal the results. As well, develop a relationship with your counselor. It can be invaluable in sorting out what's going to work for you as an individual.
Absolutely. And I know that we had a lot of questions about flare-ups and how to manage an arthritis flare-up. Should one increase dosages? Should one increase THC? Do we incorporate topicals? What sort of is your game plan?
So yeah, you could kind of say yes to a lot of those, right? So personally, I typically do, and this is very much what you say all the time, I am a profile of a typical patient. I use high CBD products during the day. I'll often go to something of a balanced product later in the day and maybe a THC product into the evening and overnight. Dosing for me is actually quite routine. I add the same amount of my CBD butter to my morning coffee every single day, really. I'll vape CBD products during the day and then use probably a little more and then a little more CBD later in the day, and then include THC for daytime breakthrough pain and muscle spasms. And I'll use a higher THC sativa when fatigue is more of a factor during the day.
So you notice that uplifting sort of energizing
I really,
effect
really
of the
do.
sativa.
But as I spoke to you the other day about Jack Herrera, which many people find such an uplifting daytime, does nothing for me. So it's a great example of how you have to explore for yourself to find out what's going to work, right? So I think I've answered your question, but as for topicals, I'm just going to mention, I'm actually looking forward to trying a topical product that is actually made by our senior counselor in London. Her name is Deline, and I haven't used cannabis topically to any large extent, so I'm looking forward to checking it out.
Okay, yeah. And again, I mean, certainly from patients, we do get a lot of feedback saying that they can be effective. So,
Yeah.
so tell me about, like, do you have any other, like, diet, exercise, additional remedies? How does that all fit into the bigger picture?
So again, I'm diagnosed with something called ankylosing spondylitis. Exercise is extremely important to manage. However, when you exercise and it leads to exertion, which quickly depletes you to exhaustion, it can be really tough getting in enough exercise. So here again is where a sativa with a moderate THC content can really help me. And utilizing a significant dose of CBD within about this is a tip. After I use my THC, utilizing a significant amount of CBD within about an hour of using a THC sativa can really help with energy and pain for me. And diet is really important too. First and foremost, hydration can't be overstated. And as is eating a healthy diet and practicing good sleep hygiene. So that would be some of my responses.
Yeah, that's great. And, a lot of patients do email us about, and, I'm sort of hoping to cover off some of the messages that I got about stubborn and resistant pain. We hear a lot about patients with hip pain. And it just, again, where they've tried a CBD, they've gone to the one-to-one, they're doing the high THC, and still not finding the results that they're looking for.
So with ankylosing spondylitis, I can talk about hip pain and SI region pain until the proverbial cows come home. I personally, with deep, stubborn, awful pain, I will often engage a deep stretch, often in an area that's in spasm, and take several deep inhalations from a vaporizer of a high THC product. I find that breathing with pain and tightness while using the vaporizer can be really effective for me.
Wow, that's great. Well, I hope that that Johnathan's insight has also helped give you guys some tips as well too, just some things to think of. I wanted to move on to Dottie's question. Do you want to read Dottie's question? And I'm happy to answer it because you've been answering a lot of questions here.
Sure. Good call. So Dottie writes in, and thanks very much, Dottie, for this one. She writes in, she says, I have an autoimmune-based arthritis. That's about a quarter of people are diagnosed with ulcerative colitis. I would be very interested in learning more about how I may use CBD and THC oils to combat the inflammation that causes an autoimmune-based arthritis to flare up, or how to treat it once a flare-up occurs. Also, how much to use and how frequently. I'm just going to briefly say this. She says, I've only had my medical license for less than 3 months, so it's pretty new, right? Yep. I'm using CBD oil twice per day, 6 drops, and THC oil for nighttime, 3 to 5 drops. I purchased a vaporizer pen with some dried cannabis, but I'm only just beginning to get comfortable with its use. Yeah, that's pretty typical. I've never smoked anything. Glad to hear that, Dottie. And the concept is taking a while to wrap my head around. Yeah, inhalation would. Yeah, Barb, take that. Yeah.
Well, I mean, honestly, Dottie, it does sound to me like you are on a very, very good path, both in terms of using cannabis and on the whole with the treatment plan. Again, we know that patients do look to completely eradicate symptoms. But again, quite often relief comes more in the form of reduction of symptoms. Yeah. And it seems that Dottie's experiencing that. So within 3 months, which I like to call, again, that's your period of investigation where you're really just figuring things out. Yeah. Those are really great steps to be taking. Yeah. Now, what's interesting is that with taking just a few drops, so 6 drops of CBD oil during day and 3 to 5 of THC at night, that's actually a very conservative dose, which is great. Probably we're looking at about 0.30 milliliters for the CBD and about 0.20 for THC. So that's really good news. And Dottie, I would say that if the THC evening dosage is working over the course of the evening, leave it as is. Now, with the CBD dosage, again, because of the lack of psychoactive effects, Dottie certainly could consider increasing that dosage quite slightly. You got a lot of headroom there. Yep. I would say easily you've got 0.80 milliliters there. Sure. So even just increasing by, let's say, 2 drops per dosage, and you may notice a general difference. Now, in the case of managing flare-ups, definitely both CBD and THC separately. Now, what's also interesting, I sort of think of looking at Dottie's question, is that for flare-up time, again, where we were talking about that 1-to-1 balance, Dottie essentially could create, by blending blending her two oils, sort of 1-to-1 ratio. So let's say if you've got, 6 drops of CBD oil, drop in 2 drops of the THC.
Absolutely.
And that's going to create just that little bit of that entourage effect. I would be very, very interested in knowing if that's effective.
Kickstarting each other.
Exactly. And what I would suggest to Dottie too is to really, again, journal that experience and say, okay, at this time I felt like this. I took 4 drops of CBD plus 2 drops of THC. I felt like this afterwards and sort of just play with those ratios until you find the right thing that works for you. Now, of course, with the vaping, yes. And I know that vaping can be a very strange feeling. I know that we have helped a lot of patients where there's just this sort of discomfort around it. I know it looks and it feels like, because you feel that vapor sort of hitting the back of your throat, it can sort of feel very similar to smoking, but it is really just water vapor. Non-combustion does ensure that no carcinogens are present. And what's interesting is that Dottie also mentions that she's using a strain that is a white berry strain, which is a lower mid-THC level indica strain. So it sits around 12 to 14%, which is before, when we were talking about sort of efficacy 14, from 9 to 12, again, just a very sort of potentially effective strain. So again, incorporating sort of inhaled cannabis for those moments where you're like, oh gosh, I'm in spasm, I'm in pain, I need something immediate. Again, just a few inhalations off of that vaporizer may be super helpful just to sort of take the edge off that pain. So I hope that answers your question, Dottie. Let's maybe move along to Johnathan. Do you want to take George's question?
Let me read George's question.
It's about cannabis. It's back to topicals again.
So George writes in, and thanks for the question, George. Cannabis creams don't seem to be widely available at this time. And are they useful for arthritis? If so, how are they used and at what strength? And can they be prepared using cannabis oil? Great question, George. Do you want to answer that part?
Well, again, and I think we spoke to this a little bit during the webinar. You're right. There are currently only a few products available from licensed producers. I want to say like maybe 3 to 4 to 5. MedRelief, CanaMed has a cream package as well. And I think that's, one of the better ones out there.
Sure.
There's a couple. Now, what is interesting is that many patients, again, they report that they find their regular edible oil CBD products, again, just a few small drops on the affected area and rub it in and see how that manages. What I think then at that point is if you're looking to explore topicals, I think that's a good starting point to actually see if it does have any effect.
CBD is highly permeable through the skin.
Yes.
Unlike the THC molecule, CBD does travels through the skin quite readily.
Yeah. So again, we certainly do encourage patients to try it out. Again, you certainly may be in a position to make your own topicals. Again, Google is your friend oftentimes, not always, but again,
be careful what rabbit hole.
Be careful what rabbit hole you go down. But I think if you Google a topical cream recipe, it should be pretty harmless. And again, that would involve stovetop extraction, usually a little bit of coconut oil and a little bit of beeswax. Now, I've heard tell as well that the addition of some emu oil may help.
I've heard that too. I remain skeptical at that one myself. And I'll just say to George's question too, you can take any cannabis oil purchased from a licensed producer, add a few drops to any type of moisturizer, cream, anything like that, make your own, keeping in mind there are certain ingredients in certain moisturizers, I want to say parabens, but I may be wrong, they can actually they can make a barrier on the skin so that the molecule CBD isn't penetrating. So a bit of something to be cognizant of there. But generally speaking, people will put some oil into any old favorite moisturizer and use that to rub it in.
Exactly. Johnathan, do you think we have time for Blair's question? It's random. He's wondering about the effects of mixing cannabis with pain medication, like morphine, other prescription medications. I know that's a bit of a big question.
And one we get all the time, right? Because we've worked with patients constantly who thought that THC would address their symptoms, only to find out that it's actually CBD that had a better result for them. And what I can say about CBD is generally considered that it's safe to use, very little interaction with other pharmaceuticals, considered a low risk in terms of interactions with other medications, and has a safe sort of profile to it by and large. So mixing cannabis with pain medications, we're not physicians, so I'm not going to speak very specifically about pharmaceuticals, etc. But what I can say is we have many patients of many different populations suffering with different ailments who are, of course, using their opiate medication and successfully use cannabis at the same time.
Yes.
Right? So, as with anything, very close supervision.
And I think, again, it does bring home, especially when we are looking at interactions with other medications. This is something that ideally no patient or anyone who is suffering under any condition should be going alone. If you are using any kind of medication, you want to have a physician involved. You want to have a healthcare practitioner involved, because they're going to be able to advise you on those contraindications. And again, really, in times where, because again, there are times where it isn't appropriate to use cannabis.
Absolutely.
So again, under the guidance of a physician at a clinic is going to be your best bet. So I think that is going to take us through questions. And now this is going to conclude our episode.
Yeah, so thanks very much again to VJ, our production master there.
Thank you, VJ.
And Megan and Graham, our online counselors, have been answering your questions.
And we're going to keep them there for a couple of minutes too. So they're going to stick around and answer for a little while. Again, if your question does not get answered, please just do email us at webinar@cannabisclinics.ca, or sorry, is that webinar@canvasrx.ca. Now with your question, if it's not answered in the chat, we'll follow up within a day or two. And again, please do join us next time. It's going to be our last webinar of the year. That's going to be December the 19th, a Wednesday night at 7:30. And I think we're going to be discussing cannabis and sleep disorders.
Sure
so that's going to be a big one.
Cannabis and sleep disorders is next. Thank you, everybody, for joining us.
Thank you, everyone. Take care.